Hello friends, welcome to the NEET PG Neurology MCQ series part 1. So we'll be conducting a series of videos. So today is about blood vessels in lateral and medial medullary syndromes. So the learning goals are to identify the vessels involved in the medullary syndromes. Let's review the basic anatomy of the posterior circulation. We have the two vertebral arteries which gives rise to the posterior inferior cerebellar arteries, and the vertebral arteries go front and join together form the basilar artery, which divides again to form the posterior cerebral arteries. In addition, you have 3, 4, 5, the superior, middle and inferior lateral medullary arteries. Coming to the vascular syndromes, first is the lateral medullary syndrome. So the vessels involved in lateral medullary syndromes are 5 in number. The most common is the vertebral artery V4 segment, followed by pica and the 3 lateral medullary arteries. You can remember them as being located laterally. Next is the medial medullary syndrome. The 3 blood vessels involved are vertebral artery, branch of vertebral artery, lower basilar artery. You can remember them as being located medially. Let's see some questions. Occlusion of which of the following vessels will not produce a lateral medullary syndrome? First, vertebral artery. Second, posterior inferior cerebellar artery. Third, basilar artery. And fourth, superior lateral medullary artery. Now, the question is that which of the following vessels will not produce a lateral medullary syndrome? We know that vertebral artery is the most common cause, so we can eliminate option A. Option B is posterior inferior cerebellar artery, which is the second most common cause, so we can eliminate the second option. Now what remains is 3 and 4. We know that basilar artery is located very much medially, and so it's involved in the medial medullary syndrome. So by exclusion or even by your factual knowledge, the answer is basilar artery. So let's proceed to the next question. Which of these is the blood vessel most commonly occluded in lateral medullary syndrome or Wallenberg syndrome? Option A, vertebral artery. Option B, posterior inferior cerebellar artery. Option C, basilar artery, and option D, superior lateral medullary artery. So we know that vertebral artery, especially its V4 segment, is involved in the lateral medullary syndrome, and it is the most common cause. Third question, occlusion of which of the following vessels will not produce a lateral medullary syndrome? Now, option A is vertebral artery V4 segment, option B, posterior inferior cerebellar artery, option C, vertebral artery V3 segment, and option D, superior lateral medullary artery. So we are in a bit confused state because we haven't yet encountered V3 segment of vertebral artery, and we are confused whether it is V3 segment or any other option. So the answer is that only the V4 segment of vertebral artery gives blood supply to brainstem and cerebellum. The rest, all segments including V1, V2 and V3, they don't supply the brainstem and cerebellum structures. So the answer is V3 segment of vertebral artery. Next question, which segment of vertebral artery is involved in lateral medullary syndrome? So it's a straightforward question. So the answer is V4 segment. So this is a take-home theory. So bye for now. I hope you have understood all the points. We'll be back with a couple of questions highlighting a significant high yielding fact the next time on YouTube. Until then, goodbye.